Depend on us for news you'll talk about all day.
KFBK.
On News Talk 1530 KFBK.
Officials with the Food and Drug Administration are considering whether or not to give the green light to the first weight loss drug to be sold over the counter. Orlistat, originally marketed as Xenocal, blocks a quarter of any fat eaten when taken with meals. However, FDA officials say the drug could create vitamin deficiencies.
Joining us live this morning with a closer look, Dr. TimRadak, spokesman for the Physicians Committee for Responsible Medicine. Doctor, good morning. Welcome to KFBK.
Good morning. Thank you.
What is Orlistat? How does it work, and how effective has it been?
Well, Xenocal is a drug that works in your intestines and blocks anywhere between 25 and 30% of the fat that you consume. There are some concerns about it blocking some important vitamins in addition to fat, and those would be vitamins D, vitamin E, vitamin K, and beta-carotene. So there's also been some questions about diabetics as well, and that it has been a drug that has not been good for people that have been on diabetics. For example, the FDA has raised that question.
Okay, so who has the drug been good for?
Well, it just depends. I mean, this is a situation where this drug is really treating a symptom and not treating a disease, and therefore there are a number of other ways that weight loss could occur in a more consistent way that's more long-term, more gradual to the body, and doesn't contain some risks in terms of vitamin deficiencies.
So obviously it's a pretty big move then, doctor, to take a drug from being a drug that can be prescribed by doctors to just being over-the-counter and available to anyone.
Sure, it is. It reminds me of actually some of the drugs that were for, some of the antihistamines for allergies and what happened with when those went over the counter. Here we have a situation where we have an epidemic, however, in obesity, and we also have eating disorders that are affiliated with obesity, and there could be some risk with using this drug for people who are bulimics, for example, and have those certain types of eating disorder conditions. And there is always that risk when we make a drug like this available to the public without a prescription.
And so safe to say you as a doctor are very concerned about this kind of thing being made available to your average person who doesn't have all the education to deal with taking such a product.
Correct. Well, and not only that, to add to this is just there are other effective ways to lose weight without having to use drugs, and those ways are ways that address lifestyle habits as opposed to the actual symptoms of a disease like obesity. I mean, that's really the key. No weight loss drug or weight loss diet, for that matter, has ever worked long term because it never really addresses the actual reason why people get into a state of obesity. And my concern is with drugs like this is it may be just giving the green light for people to continue to eat unhealthy and to continue to eat high-fat products which add to weight gain, and then thinking they can just take a drug to fix that.
Doctor, we have to wrap you up here because we're just about out of time. Real quickly, though, you are spokesman for the Physicians Committee for Responsible Medicine. Are you just kind of waving the flag here, or has your group taken some sort of stand, for example, saying this drug should not be sold over the counter?
Well, we've done a lot of clinical research actually assessing the utility of a vegetarian diet for long-term consistent weight loss, and we just published an article actually for a clinical trial we did testing a low-fat.
What about this drug, though, specifically?
Well, when there's a better approach, such as a plant-based diet, we recommend that over any drug that would be prescribed for weight loss.
All right. We sure appreciate your time. Dr. Radak, again, spokesman for the Physicians Committee for Responsible Medicine.